Okay, now we are going to talk about kidneys. And all of us have kidneys, but how well do you know your kidneys? So, your kidneys are a pair of dark red or reddish brown, bean shaped organs, each about 4 or 5 inches long, around the size of a closed fist, and located just below the rib cage, typically one on each side of your spine, retroperitoneal. Although most people are born with 2 kidneys, there are some, unfortunately, are born with only 1 kidney. So your kidneys belong to the urinary system. And your urinary system includes your kidneys, ureters, your urinary bladder, and your urethra. And this system filters your blood, removing waste and excess water. And this waste becomes your pee. But for now, we'll just be talking about your kidneys. So each kidney is enclosed in a renal capsule which is surrounded by adipose tissue. Internally, the kidneys consist of a renal cortex, renal medulla, renal pyramids, renal columns, major and minor calyces, and a renal pelvis. And the blood enters the kidney through the renal artery and leads through the renal vein. Okay, now let's discuss each part of your kidneys. So again, you have your renal capsule, which is the top fibrous connective tissue, closely envelopes each kidney and provides support for the soft tissue that is inside. And then internally, you have your renal cortex, as shown in this picture, which is the outermost layer, the reddish region next to the capsule, where the nephrons, known as your blood filtering units, begin. Your renal cortex also creates the hormone erythropoietin, which helps make red blood cells in your bone marrow. So, portions of the renal cortex extend into the spaces between adjacent pyramids to form the renal columns. Your glomerulus and convoluted tubules, which will be discussed later, of your nephrons are located in the cortex of the kidney. Your renal medulla, which is the middle part layer, darker reddish-brown region, consists of approximately about 8 to 12 renal pyramids in each kidney. And it contains the blood vessels and the tubular structures of your nephrons, and they help regulate the concentration of urine by filtering out water, salts, and acid. It contains most of the nephrons with their renal tubules which carry urine to the renal pelvis. So this is a closer look of your renal medulla. And the whitish structure, which is elongated at the tip of the pen, that represents your tubular structures. Now let's talk about your nephrons. They are the functional component of the kidneys, and they are responsible for where the real business of filtering the blood to produce urine or pee making begins. In 3 steps, you have your filtration, reabsorption, and secretion or water conservation. Each nephron consists of a round renal corpuscle that resides up in the cortex, followed by a long and winding renal tubule that loops around between the cortex and the medulla. A healthy adult has 1 to 1.5 million nephrons throughout the kidney, located in the renal pyramids. So there is your renal corpuscle, consists of Bowman's capsule and the glomerulus. Now your glomerulus, which is the filtering unit of the kidney, is a complex network of capillaries uniquely interposed between your 2 arterioles, the afferent and the efferent arterioles, which will be discussed later. And this glomerulus has this cup called glomerular capsule or Bowman's capsule. They then pass filtered substances to the renal tubules. The name for this process is glomerular filtration. So as mentioned, you have your afferent arterioles, and these lead into the renal corpuscles and bring blood into your glomerulus and dilate or get wider to allow for more filtration. And then you have your efferent arterioles, which take blood out of your glomerulus and leaves the renal corpuscles. Now let's talk about your renal tubules. They consist of 4 parts that include your proximal convoluted tubule, your loop of Henle, the distal convoluted tubule, and collecting duct. Each part plays a role in homeostasis of water and electrolytes. Homeostasis is the process in maintaining a stable internal environment to survive and function properly. Now, these tiny tubes reabsorb and return water, nutrients, and minerals your body needs, including sodium and potassium, and whatever is not needed will be removed as waste, including excess acid and fluids, through a process called diffusion, and will go through your kidneys, collecting chambers, and eventually leaves your body as pee. Now, diffusion is the net movement of anything, generally from a region of higher concentration to a region of lower concentration. Okay, let's now talk about your proximal convoluted tubule, known also as PCT, and is shown in the blue color in your diagram. So your PCT is the first segment of the renal tubule where it receives the filtrate from the renal corpuscle, and it is responsible for the reabsorption and secretion of various solutes and water, and reabsorbs about 65% of water and ions, which include your sodium, potassium, chloride, calcium, and magnesium. So about 75% of the glomerular filtrate is normally reabsorbed in your PCT before it reaches the loop of Henle. And PCT is the only place where glucose gets reabsorbed back into the body. So most simple sugar that gets filtered here, 100% of which needs to be thrown back into the body. But if too much glucose gets filtered, we won't have enough time to throw it all back, and it will come out in the urine. And you notice that it most often happens with diabetics. And because glucose has a strong osmolarity, it has a strong pulling force, pulling water with it. So you end up going to the bathroom a lot to pee, and you notice that in most diabetics. Now we have the loop of Henle. It has a hairpin configuration and shown in green color in your diagram. And it has a thin descending limb and both a thin and thick ascending limb, which contributes to the absorption of approximately 25% of filtered sodium. Now your descending limb of loop of Henle is highly permeable to water but not to salt, and it is the primary site of water absorption. Water is the main thing that's reabsorbed here, and this is really important because the longer this thin loop of Henle is, the more water is thrown back into the body, and that's important in terms of dehydration. However, small amounts of urea, sodium, and other ions are also reabsorbed. Now let's talk about the ascending limb of the loop of Henle, and it is the place where the urine is being drained into the distal convoluted tubule, or DCT, and it plays a role in urine concentration. Now this ascending limb connects to the descending limb of the loop of Henle, and it leads to a sharp bend. So I just mentioned earlier, there's the thin ascending limb and a thick ascending limb. Your thin ascending limb is highly impermeable to water but permeable to solutes. Your thick ascending limb, on the other hand, is the primary site of sodium reabsorption and is not permeable to water. So it makes the urine diluted. And they reabsorb a large amount of potassium, calcium, and magnesium. Now let's talk about the renal papilla. This is the tips of the renal pyramid through which the urine formed in the kidney passes and which collects the remainder of the filtrate that consists of waste and solutions, and then deliver this filtrate or urine into the minor calyces which connect to the ureters to deliver it to the bladder. Your dehydration and certain medications, especially non-steroidal anti-inflammatory drugs, may damage your renal papilla. So you have your minor calyx, surrounds the renal papillae. It is a pyramid-shaped structure and collects urine from that pyramid. Urinal filtrate from the renal papillae drain into the minor calyces and into major calyces thereafter. Several minor calyces converge to form your major calyx. There are usually 5 to 11 minor calyces in the kidney and collects urine from the renal papillae and passes it into the major calyx. Now you have your major calyces or calyx, which is a cup-shaped cavity that collects urine from the minor calyces and drain into the renal pelvis, and from there, it flows into the ureter. Now another structure or part of your kidney is your hilum, and it is your entry and exit sites where renal artery, renal vein, and ureter comes out. And also, how can the blood goes in to the kidney and goes out from the kidney is through your renal artery, which is a large blood vessel that supplies oxygenated blood to the kidneys, whereas your renal vein is a large blood vessel that carry filtered blood out of your kidneys and back to your heart. So those are the most important parts of your kidneys, which main function is for filtration, reabsorption, and secretion or water conservation. And because you now know your kidney much better as a vital organ to your overall health, it's important to take care of your kidneys, and they will take care of you. Thank you for watching, and I hope you learned something. And please subscribe until the next video. Bye!